It was the swingin' 60s, and the birth control pill had just become legal for married women.
Birth control, especially the pill, provided women the choice.
A sexual health care revolution ensued, thanks to a 1965 case called Griswold v. Connecticut. But even that decision came into question last summer after Roe was overturned. Justice Clarence Thomas suggested the nation's highest court should reconsider the Griswold ruling, too.
Even patients in Washington state are nervous.
In Washington, abortion is still legal. However, a renewed focus has arisen on reproductive health care.
I feel like that's almost when I heard more conversations around this uncertainty for patients in Washington state. Like, what does this really mean? What's really going to happen?
Many Washington women aren't taking any chances.
We actually saw a 60% increase in birth control appointments between June 2021 compared to June 2022.
And while some of that uptick can be attributed to pandemic disruptions, Dr. Erin Berry says the timing can't be denied.
There was a lot going on in the sexual and reproductive health world in June 2022.
She also cites a recent uptick in Washington women seeking intrauterine devices, or IUDs, which can prevent pregnancy for up to 10 years.
We are seeing a trend in increasing use of more long-acting birth control methods.
Aside from Planned Parenthood clinics, Washington state also helps fund 350 clinic sites called community health centers. They're located in medically underserved areas and provide free or low-cost health care to more than 1.1 million Washingtonians per year. Unfortunately, IUDs have been hard to come by.
On average, only 52% of community health centers are able to dispense IUDs and implants. They can't afford to stock them.
But new funding in Governor Jay Inslee's state budget, just approved, should change that, says Upstream's Liz Elwert.
This will increase the options available to them and will improve the quickness with which they are able to access it. They want to get it as soon as they can while they still can.
And worth noting, last month, the FDA advisors voted in support of making a birth control pill available over the counter. The American College of Obstetricians and Gynecologists told NBC News they believe this could be helpful for the most marginalized Americans. Madison?